Okay, class, as we move on to the skin, we start going into the systems. The first system we're going to go into is the integumentary system. Now here's some fun facts. It's waterproof, of course, by stratified squamous keratinized epithelium. Very stretchable because of the elastic and collagen fibers. Obviously washable. Hopefully you take a shower every day. Invisibly repair small cuts, rips, and burns. Guaranteed to last a lifetime with reasonable care. Weighs on average between 9 and 11 pounds, so approximately 7 to 15% of your total body weight. Measures about 1.5 and 4 millimeters thick. And you have thick skin, does not have hair follicles or oil glands. That's your palms and your soles. One last interesting factoid about skin. Every square centimeter of your skin, so every square centimeter contains 70 centimeters of blood vessels, 55 centimeters nerves, 100 sweat glands, 15 oil glands, 230 sensory receptors, and approximately 500,000 cells that are constantly dying and being replaced. You lose 40 pounds of cells within your lifetime. Also, you ever, when you're sitting on the sofa and then you see the ray of sunshine that hits it and then you see all these little dust particles that you see kind of floating in the air? Well, most of that, besides dust, is all your dead skin cells that are floating there. Yummy. All right. Your skin is a vital part of your life and appearance. Some people choose to embellish it with tattoos, with makeup, piercings, hair, you name it, but everything that makes you an individual, right? And we'll discuss tattoos a little bit later. So what's the function of the skin? Protects deeper tissues from mechanical damage, chemical damage, bacterial damage, thermal damage, ultraviolet radiation, and desiccation, which is, what does desiccate mean? To what? Dry out. So it prevents that. Skin is composed of two main layers, which is the epidermis and the dermis. The epidermis is made up of closely packed epithelial cells, and the dermis is made up of dense, irregular connective tissue that houses blood vessels, hair follicles, sweat glands, and other structures. And then below the dermis is your hypodermis, where your fat adipose tissue is. The skin, it's a cutaneous membrane. Skin derivatives have sweat glands, oil glands, hair, and nails. Evolutionary development in vertebrates due to changing environments. Okay, so this is an evolutionary development. The sweat glands, the oil glands. Remember I told you the sweat glands, you can outrun a cheetah because of the development of the sweat glands. What's the skin function? Aids in heat regulation, aids in excretion of urea and uric acid, synthesizes vitamin D, detects cutaneous sensations like little spiders crawling all over you, stores blood, and protects the body from external environment. So the skin is very, very important. Keep your skin hydrated and take care of your skin. So I showed you that video, but how effective is hand sanitizer? Alcohol-based sanitizers can quickly reduce the number of microbes on hands in some situations, but sanitizers don't remove all types of germs. Okay, so hand sanitizers may be not as effective when hands are visibly dirty or greasy, and washing hands with soap and water is still the best way to reduce the number of microbes in most situations. When it comes to the flu, do a little hand sanitizer and wash your hands. If soap and water are not available, then use alcohol-based sanitizer that contains at least 60% alcohol. This is an 8-year-old's handprint after playing outside. Those are all the germs on his hands. Nasty, right? And then they go in and they eat. So, thin skin versus thick skin. These slides show cross sections of the epidermis and dermis. This is thin and this is thick skin. So the epidermis is epithelium composed of multiple layers of cells. The basal layer consists of cuboidal cells, whereas the outer layers are squamous, keratinized. Remember, keratinized is your waterproofing layer. So when you look at the epidermis, composed of epithelial cells, not vascular. That's why when you shave, it doesn't hurt and it doesn't bleed unless you use like Mach 8, which it goes down to the dermis, then you bleed. So when you shave and you bleed, you went past the epidermis into the dermis. It's made up of 4 types of cells, consists of 4 to 5 distinct layers. New epidermis is regenerated every 25 to 45 days. So it's a new you every 25 to 45 days. The cells of the epidermis, you have some dead keratinocytes, lamar keratinocytes, Langerhans cells, Merkel cells, sensories, melanocytes, dermis, and we'll talk about these cells more particularly as we get further in the lecture. Now, so let's look at the cells of the epidermis, and then this is the first layer. So you have the keratinocytes. They produce keratin, which is a fibrous protein providing external protection. It forms in the deepest layer of the epidermis, and it migrates to the surface, and it usually sloughs off. You have melanocytes. These synthesize pigment. This is what gives you your skin color, okay, called melanin. Remember, in humans, we actually have the same number of melanocytes. So the only thing that determines skin color is the amount of melanin that you produce. Okay, that's the only difference between black, white, yellow, brown skin color. That's it. Found in the deepest layer of epidermis, protect keratinocytes nucleus from UV radiation, so that's very important. So the darker you are, you live in a more warm climate because it has to protect you from UV radiation. The lighter you are, it's because you have an area that is not exposed to UV radiation. That's all skin color is. You have dendritic cells, aka Langerhans cells. They form in bone marrow, migrate to the epidermis. Macrophages that help to activate the immune system, so those are found on your epidermis. Easily damaged by UV radiation. And then, of course, you have tactile, also known as Merkel cells. This is at the epidermal dermal layer, and they sense receptors for touch or little spiders crawling all over you. Every time I say little spiders crawling on you, you probably get that sensation that something's crawling on you. Watch out! Now, in thick skin, soles of the feet and palms, there are 5 layers. Strata everywhere else, you have 4. So layers of the epidermis in thick skin. Okay. You have superficial deep, you have stratum corneum. The stratum lucidum is only present in thick skin. So that's why you have 5 layers in thick skin. But in thin skin, you only have these 4. So make sure you know that stratum lucidum is only found in thick skin. So these are the layers: stratum corneum, stratum lucidum, found in the palms, okay, and soles of the feet, stratum granulosum, stratum spinosum, stratum basale, then you have melanocytes, and then the dermis. So those are the layers of your epidermis. Layers of the epidermis, you have the first layer, the stratum basale, cells undergoing mitosis. So if you go back here, that's the stratum basale, the deepest layer. Cells undergo mitosis there. It lies next to the dermis. And then you have stratum spinosum and then stratum granulosum. The stratum lucidum, that occurs only in thick skin. And then you have stratum corneum, which is your superficial layer, shingle-like dead cells that kind of slough off. Here's something interesting. Why do your fingers and toes wrinkle when wet? So the current theory is actually wrinkly fingers and toes improve our grip on wet or submerged objects, working to channel away the water like tread on a tire. It's believed to be involuntary, so you don't have to think about it. A reaction by the body's autonomic nervous system. Wrinkling is caused by blood vessels constricting below the skin. What's interesting is if you have damage to the brain, you actually won't get wrinkly skin. Interesting, right? So we know that it comes from the autonomic nervous system. And if you have damage, even if you were to submerge a patient that had damage into water, they will not get wrinkly skin. The epidermis of the skin has 5 layers. Again, this is just good review. Cells of the epidermis. The cells in different layers of the epidermis originate from basal cells located in the stratum basale. Remember, mitosis goes through in the stratum basale. Now let's go into the dermis. So all that was epidermis, which is your first layer. Now the dermis. This stained slide shows the two components of the dermis. You have a papillary layer and you have a reticular layer. Both are made up of connective tissue with fibers of collagen extending from one to another, making the border between the two somewhat indistinct. The dermal papillae extending into the epidermis belong to the papillary layer. All right. So the main function of the dermis is to support the epidermis. Strong, flexible connective tissue, dense, irregular. You have collagen and elastic fibers. What are the cell types that you find in the dermis are fibroblasts, macrophages, mast cells, and white blood cells. Binds the entire body together. So without a dermis, you'd be just a mess. You ever watch the movie The Blob? It's highly vascularized. That's why I told you that when you cut yourself, you're actually gone down to the dermis. When you get tattoos, you know this, that you bleed. If you get henna, obviously you don't bleed because henna is in the epidermis. Hair follicles, oil glands, and sweat glands. Again, these are evolutionary adaptations that we made. And then the two major layers of the dermis are the papillary layer and the reticular layer. The dermis papillary layer, highly vascularized, so that's the first layer, borders the stratum basale of the epidermis, so that's right there. Touch and pain receptors, so Meissner's corpuscles, highly innervated. You have them also on the palms and soles. These papillae lie atop dermal ridges, which produce whorled epidermal ridges, and those are your fingerprints. Okay, and epidermal ridges provide fine texture reception and gripping for wet, smooth, and rough objects. All right. Now the papillary region again is 1/5 the thickness of total dermis. Surface area increased by the dermal papillae. Dermal papillae can contain Meissner corpuscles, nerve endings for touch, and free nerve endings to feel warmth, pain, tickling, itching, and coolness. So some of you say, oh, I'm not ticklish. Well, then your dermal papillae may be hindered. Okay. Now the next layer is the reticular layer. That's 80% of the dermis layer. That's collagen, binds water, helping to hydrate the skin. Remember, you want nice looking skin, then you got to have good, healthy collagen. Elastin fibers give skin the elasticity. Okay, so again, collagen and elastin give it that nice skin elasticity. Again, the reticular layer, which is deeper, it's attached to the hypodermis, which is your fat. Consists of dense, irregular connective tissue, collagen, elastin fibers. Between fibers are hair follicles, nerves, oil glands, and sweat glands. Elasticity allows for stretching of the skin, overstretching, which are torn dermises, which are stretch marks. So if anybody tells you that, oh, there's a cream or something that could get rid of stretch marks, lo siento, there's nothing you can do because you tore your dermis. Okay, that's like saying, oh, you can wash a tattoo away. You can't wash a tattoo away, just like you can't get rid of stretch marks. Sorry. Now here's something that's very interesting is that dermal modifications result in characteristic skin markings. So these are called cleavage lines. And the reason that cleavage lines are very important is with plastic surgery. So what happens is if you do incisions along the cleavage lines, you actually scar less. So plastic surgeons study these cleavage lines very, very closely, and they'll find that if you want less scar tissue, especially along the face, look at the cleavage lines in the face. So they really try to follow these cleavage lines, and you scar less if you actually follow these. Now, look at the knee. If you look at the cleavage lines on the knee, they actually go what? Not vertically or horizontally, right? They go horizontally. But when you get an incision in the knee, what do you usually get? If you get a total knee replacement, that goes vertically. So you're going to scar quite a bit if you get a vertical incision in your knee. Okay? So it just makes sense where, so that's why, depending on where you have certain injuries, you have certain scars. You're like, oh yeah, well if you didn't get cut exactly like this, then you're going to have a pretty gnarly scar. So interesting. These are called cleavage lines. When you're ready for surgery, whether it's facial or breast augmentation, the plastic surgeon will follow these cleavage lines to make sure you have minimal scar tissue. All right, blisters. Ooh. Blisters are actually a separation of the epidermis and the dermal layers, filled by a fluid-filled pocket. First degree burn is the epidermis only, and the second degree burn is the epidermis and dermis. So we'll talk more about burns and blisters, all that. But see this right here? That's a blister. So it actually separates the epidermis from the dermis. And you've had these. You forgot to turn over here. That's a second degree burn. Now you have Meissner's corpuscles. You have these receptors in your skin that are sensitive to touch. You have Pacinian corpuscles, which do gross touch or pain. And then you have root hair, which are dendrites that send messages to the brain regarding movement. So if you've got little spiders crawling over you. Cutaneous sensation. Skin supplied with cutaneous sensory receptors respond to stimuli outside the body. Meissner's corpuscles and Merkel disc make us aware of caress and touch. Pacinian corpuscles feel bumps, contact involving deep pressure or vibration. Root hair plexus, wind blowing through the hair. And bare nerve endings in skin, that's painful stimuli. So all these little receptors will give you different sensations on your skin. And that's a Meissner corpuscle right there. Now tattoos. Tattoo ink is injected into the dermal layer to achieve a permanent design. You ever seen these crazy tattoos that glow in the dark? UV tattoos use special ink that is only visible under black UV light. You're like, oh, that's cool, Patel. I'm going to get one of those. No. What is this? Rude life. That's crazy. Check out this zombie boy here. Remember, tattoos are forever. So make sure you go to someone that knows how to spell. Knowledge is power. Believe in myself. No regrets. You only life once. And I'm sorry, you know, I'm a Michael Jackson fan, but that doesn't look like Michael Jackson. He touched so many forever with us. I don't know. I don't know if this is, I don't know. And then some people go overboard with plastic surgery. I mean, she looks great right here. Then she wanted to look like Angelina Jolie. And then she looks okay here, but then she got crazy here. Some say this is a little bit overboard Photoshop, but actually if you've seen real pictures of her, she actually does look somewhat like this. Maybe not as extreme, but it does look pretty much like this. Should have just left it just like that. This looks great here. People sometimes just go overboard. All right, skin pigmentation. Our society is always so, I don't know, it makes me furious about skin color. But the relative coloration of skin depends only on the amount of melanin produced by melanocytes. That is the only thing that determines your skin color. That's it. There's no reflection of the person you are based on skin color. It's just the amount of melanin. That's it. So, you know, if you go back to Michael Jackson, he had a good, I mean, he's a good looking guy here. Then he started getting and bleaching his skin, started getting nose jobs. Then he really went white and really bleached it. Then he did some more, and then he just went crazy. Right, so look at his nose and really bleached his skin. It just, yeah. Again, don't change what God gave you. Beautiful right as you are. All right? This doesn't even look right. You ever see some of the actors that have like Botox and those fat lips, duck lips and all that? It just doesn't look right. All right, so melanin, again, skin color. Darker skinned people rarely have skin cancer because melanin is a natural sunscreen. All humans, this is a great question, all humans have the same number of melanocytes. Individual and racial differences in skin color reflect the relative kind and amount of melanin made. So melanocytes of black and brown skinned people produce many more and darker melanosomes, finger-like extensions of the melanocytes, and their keratinocytes retain it longer than fair-skinned people. That's it. From a physiological level, it's just the amount of melanin in the melanocytes. That is it. So if pigment variation, if you're dark, intermediate, or light, your upper keratinocytes have evenly spread melanin. Your melanosomes release melanin granules. Your basal keratinocytes take up more melanosomes, and melanocytes has many dendrites and is active. So that's what gives you a darker skin tone. In light skin individuals, they're very tie-like cells, contain little spread out melanin. The melanosomes stay intact. They don't release melanin granules. The basal keratinocytes take up fewer lighter melanosomes, and the melanocytes has fewer dendrites, so not very active. That is the only difference between light-skinned individuals and dark. Why don't you tweet that or post that on your Instagram or do a TikTok on that versus all the other dumb things that I see, right? So I wish we need to educate all these people about skin color and what the real physiological reason is. All right? Excessive skin exposure